Welcome back to What's New. Last week, we told you about a decision by Cleveland Clinic to make vaccines mandatory for anyone involved in a kidney transplant surgery. Though the move is to keep people safe, one family says it stands in the way of life-saving surgery. Lena Lai has more.
It made us feel like we were back to square one.
It's been a nearly 2-year journey since square one, when Debi Ganim's husband, Mike, learned his kidney disease was so advanced, doctors declared.
It is transplant time. We need this. No dialysis. We need a transplant, and we need it as soon as possible.
Hope for a donor began to wane when Debi posted on Facebook asking for the public's help. Friends, even strangers, offered to be tested to become a donor. And then,
oh my gosh, I cannot believe that we finally are reading the words, "I am your match."
I'm your stranger.
It was Sue George beating 1 in 100,000 odds of a non-relative being a match. Sue's daughter was one of Debi's third-grade students.
That was like 13 years ago. And we've stayed in contact ever since.
I get emotional just thinking about it because she's been so generous. Just to try.
I just have to try. I have to try to help them.
Surgery was approved and scheduled for this Wednesday. But last Friday, the devastating news. A new policy at the Cleveland Clinic now requires both organ recipients and donors to be COVID vaccinated. Sue is not. The surgery on Wednesday would not happen.
All I remember feeling was, what are we going to do? Where do we go now?
Is getting the vaccine an option?
I've got, reasons, medical, religious, and also freedom.
Now, life-saving surgery that was days away is uncertain, as is time.
And it's all because of some policy that was just decided, that because she's not vaccinated.
Lena Lai, 3 News.
The clinic issued a statement saying health and safety of patients is a top priority, and for the living donor, preventing COVID-19 infection around the time of their surgery and recovery is crucial. This is a really unfortunate situation. I can completely understand why the donor who is not vaccinated would want to keep that as their choice, not to be vaccinated. My question is, I would imagine there would have to be another facility that is doing transplants that they could have perform the surgery.
Yeah, I don't know. I mean, you build up a relationship with your doctors,
sure,
especially in a life-threatening condition like that, and then, to just pivot and try and go somewhere else when you're already in the system in one hospital. I would think you'd have to almost start over at a new hospital.
I don't know. I don't know about the red tape. I'm sure there would be red tape involved, but if to me, the recipient and the donor want this to happen, and they're both equally aware of the potential risks involved. We know what the risk is of not getting the procedure. This is clearly life-threatening. So to me, this is a decision between the donor and the recipient. And if they're both clear and understanding of the risks, every surgery has a risk.
Absolutely.
I'm going to have a procedure soon, and I'll have to sign a waiver that says I understand that when I go under this anesthesia, that there are certain things that could happen to me.
Sure.
I weigh those risks, I sign the paper, and I have the procedure. I would imagine they could shop this to any number of hospitals that do this procedure and probably wouldn't have a hard time finding one that would do it. It won't be the clinic. I hope there's a happy ending to both.
Well,
I do.
We'll keep on top of it.
Yep, we certainly will.